Introducing sex education awareness at the adolescent stage can be a better way to address sexual and reproductive health challenges affecting the young people in their communities nowadays. During growth and development, young boys and girls experience various changes, which include physical, emotional, and social challenges. In 2018, the government of Uganda, through the Ministry of Education and Sports, launched the National Sexual Education Framework that aims at teaching acceptable information to school pupils and students on sexual development, reproductive health, interpersonal relationships, affection, intimacy, body image, and gender roles in consideration of the appropriate age, culture, and religion. According to Uganda's National Population and Housing Census 2014 main report, it indicates that 33% of the estimated population is made up of young people below the age of 19 years, with potential opportunity and assets. Unfortunately, this also comes with the ability to access misleading information about sexuality.
There are very many sources. There are some good sources and some others are not worth it. Because right now, if you see, there are movies on TV that are not good. Even you see at a certain time, they write, if your child is below 13, please tune to another station. But of course, you see that at times they watch TV when you're not even home as a parent. There's a lot of internet and a lot of people are watching pornography. You find a young person, it's just buying data, you access, you log in, and things are on display. And of course, you used to see other papers, the papers which are also carrying pictures of people who are in nudes. So however much there are other sources like what we have here in Naguru, we have IEC materials, that is information, education, and communication materials that are in variety of topics, consequences of pregnancy, about HIV/AIDS, about STIs. So that's what I would call the good information as a source of information on sexual reproductive health issues to the young people. However, there are issues that are not good content for the young persons.
There is also an increase in the rate of prostitution, alcohol consumption, and drug abuse among young people, which exposes them to high risky sexual activities that may lead to school dropout, teenage pregnancy, gender-based violence, and also acquiring sexually transmitted diseases, for example, the deadly HIV virus.
Sexually transmitted diseases are diseases which a he or a she can get through having unprotected sex.
Sexually transmitted diseases are diseases got after playing unprotected sex with an infected person.
Sexually transmitted disease is the disease transmitted through unprotected sex with an infected person.
Sexually transmitted infections, STIs, also known as sexually transmitted diseases, STDs, are caused by viruses, bacteria, or parasites, which are transmitted through having unprotected sex. Bacterial infections are chlamydia, gonorrhea, and syphilis. Viruses cause genital infections like hepatitis B and human immunodeficiency virus, HIV.
Someone can know that he or she has sexually transmitted diseases when he notices that he has itches in the genitals, unusual smell, and swollen testicles.
A girl can know if she is suffering from gonorrhea
when she gets the pass from her private parts.
If someone is to know about their HIV status, is to go to the hospital to consult a doctor to know whether he or she is HIV positive.
And how we identify them easily, because you find out that since it's a drop-in center, a young person comes with itchings. So when the young person comes with itchings, then definitely you know something must have happened. And then we talk to this young person because we are professionals in that. You don't go straight away by putting questions. First of all, be friendly to this young person. And then the young person opens up to tell you, you know what, A and B, C, D happened. I had unprotected sex. So that means if a young person has unprotected sex, there are a lot that is involved. One, if it's a girl, then you must know there could be pregnancy. They could be acquiring HIV. They could be getting like STIs. So we've identified, we've got other issues that are attached to that one issue the young person had come for. And then of course, for purposes of like pregnancy, we give them emergency contraceptive pills to prevent them from getting further pregnant. But that also works within 72 hours. Those are 3 days.
Looking at issues like teenage pregnancy, we try to provide services to prevent that. Prevention is better than cure, like we all know. So one of the things we do to prevent teenage pregnancies is to provide accurate, age-appropriate information for the teenagers so that they are able to make the right decisions concerning their choices and their health. Many times we've received teenagers here who do not even know how people get pregnant, but they are pregnant. They did not know that they will get pregnant when they had the sexual encounter. So what we try to do is to give them this information so that they do not get caught in such scenarios. So when you feel that pain, the lower abdomen, when you're not even in your menstrual period, or you have bleeding from your vagina when it's not yet, your period, or you have abnormal discharge that is unusual, smelly, itchy from your vagina or your penis, or itching in your private parts, usually they are indications of sexually transmitted infections. So when you come to our facility, you'll be, the